Welcome to this seminar. This is a seminar for Purdue Global University. My name's Sonia Simon. This is for my clinical 6. It was a requirement that we pick a bill that was or was not passed in legislation that is a healthcare policy that would affect on nursing practice or nursing education. As you can see, I chose nursing practice. The bill is Nurse Staffing Standards for Hospital Patient Safety and Quality Care Act of 2019. This bill was not passed, just so you know. The assessment standard for the bill 1357, this bill addressed nursing shortage in the hospital and other healthcare facilities. If the nursing shortage is not going to be addressed, the following will occur for the ANA, American Nursing Association Standards of Practice. First of all, the patient will not receive proper medical care as far as the nurse from the nursing staff. Patient will not receive any quality care. There's more chances that the patient will experience some medical mistakes that can occur during the hospitalization, and this will also increase in the medical malpractice lawsuits. It can increase also the length of stay for the patient. The nurses will lack proper training to take care of critically ill patients, which will jeopardize their nursing license because of the lack of staffing to properly take care of the patients and the lack of knowledge. Sorry about that. Diagnosis standards, patient will be admitted to the hospital with more serious illness, more chronic conditions, and this will demand in more demanding care. I'm an OB nurse. I can see, I've been doing it for 24 years. I can see from the time I started to now, we are having more and more people that are becoming more chronically ill, have more, come in with chronic illnesses, and there's just more and more people are getting diagnosed. And acute illnesses, of course. Due to this problem, we need more nurses that patients will obtain and receive proper medical training and the nurses must receive the up-to-date information on how to take care of these ill patients. Nurses who are taking care of these patients with more seriously ill illness or chronic illness, they need to obtain, the nurses need to have decreased patient ratio on his or her assignments. Sorry about that. Outcome for adequate nursing staff on the floor. Patient will receive proper nursing care, will receive proper quality care. This will have a better patient outcome. There will be less medical mistakes, which will be less medical malpractice lawsuits. Decrease in hospital stays, which I can see that. Years ago, postpartum patients, they usually stayed to day 2. Now they're going home on day 1. Also, post-op patients are usually day 3, a lot of times day 4, and now they're going home on day 2. Nurses will be provided evidence-based practice information to apply to their practice. Nurses will have proper training and taking care of certain patients. Like I have proper training to take care of fetal demises. Not all nurses can take care of fetal demises in the OB unit. Nurses' license will not be jeopardized because of increased nursing staff. planning standards, provide evidence-based practice data this is very important because this will explain the reason why the nurses are doing a procedure, protocol, policy in their practice. They should have a checklist to be completed to prevent any medical mistakes. Have proper nurse-patient ratio to perform proper quality care for each patient. Have all nurses must complete annual competencies that are specific to the nursing units that they are working in. Implementation, the mandatory review session on all protocols, procedures, and policies on that nursing unit. That includes the evidence-based data results. This will be updated, the nurses on how and why and the reason for this information. I can give you an example of this. Years ago, we used to count to 10 for a patient when they were in labor. We don't do that anymore. We just tell them to hold the breath and to push as long as they can. Even if it's 3, it doesn't matter. They found that overexertion can actually exhaust the mother more, have improper pushing techniques, and will have longer labor phase as far as to deliver the baby. After reviewing sessions, the nurses will have to follow a checklist on certain procedures, policies, and protocols to prevent any medical errors. This in OB, I know, is utmost important. We have a sheet of paper that is our checklist that goes from the time that they are admitted to the time that they are discharged. And this we do just to make sure that we are not doing anything wrong, that we're completing all of our documentations that we need to complete. We do exploratory studies to see how many patient complications and medical errors that occur with current patient ratio versus the suggested patient ratio for the bill. The patient ratio for OB for the bill is only 3 couplets. That's 3 moms and 3 babies. Currently in my institution that I work, we have 4 couplets. That's the norm. Every now and then we get 5 couplets, but that's very unusual, but the norm is 4. And a lot of times it doesn't matter as far as if we have a complicated patient or not. We have to basically put our big girl pants on, and if we need help, we need to, call the proper chain of command to ask for help. Annual competencies is to make sure that all of the nurses have the necessary understanding for instructions for the policies, procedures, and the protocols for that area. This is at most important. I can give you an example as far as for Pitocin, the Pitocin protocol. Years ago, it was up to the doctors, but now the protocol is only going up by 2 million equivalents of Pitocin every 20 minutes. So you just need to know, all of your policies and procedures and protocols for your unit that you're working in. Coordination of care standards. The nurses will follow the instructions, procedures, and policies, protocols to present patient care with the newest up-to-date evidence-based data. The nurses will follow a checklist to validate the proper order. Performing certain techniques is done correctly on the patient to prevent any medical mistakes. If the patient's safety ratio is activated, This will provide safe environment for the patient and will have a positive and shorter hospital stay for the patient. The nurses will accomplish any annual competencies requirement to protect the patient and to have the knowledge on the current information. Health teaching and health promotion standards. Applying the most recent evidence-based practice material, this will improve the best patient outcomes and shorten hospital stays for the patient. The current checklist will, if you do that, doing the protocols and procedures will help reduce medical errors, which will reduce any potential extended stays in the hospital. Having a safe patient ratio will give the patient quality care and better patient satisfactory surveys, which is, I know, a big thing as far as with hospitals, that they like the patient satisfactory surveys to be high. Having staff members competent on the hospital policies, procedures, and protocols. This will keep the patient and also the nurse safe. Evaluation. How we're going to evaluate all of these 4 areas is the nurse will verbalize awareness of all current procedures, policies, and protocols, or where to find all of these and print them out and know what they're doing during that situation when they're taking care of that patient. So, and understand that the evidence-based practice, how that supports all of those important aspects of the hospital and institutions requirements. Nurses will decrease medical errors by performing a checklist on certain procedures, policies, and protocols. This will be evaluated by statistics, is collected by ongoing studies on the unit. Safe patient ratio will help increase the patient outcome and decrease the patient length of hospital stay. This will be done by a census. And of course, the competencies will be done on e-learning tests. There is an evaluation tool that educators can get access and see if there's any staff members or personnel that needs to have some extra explanation so they can understand what they need to do. Do you have any questions? If you do, please contact me. You take care. Have a great day. Thank you for coming to the seminar. You take care. Have a great day.